Hey y'all, welcome back to my channel. Don't forget to, if you're not already, like, comment, subscribe to my channel and help me get to 200 subscribers. I think I need like 3 or 4 more subscribers to hit 200. So I would love if y'all would help me get there. So I get asked this question a lot. Had asked me, some people ask me, do I like being a MED-AIDE better or a CNA? Like, which one would I rather do? So my answer to that question is it depends on where I'm working at. Now, if you watched my older videos, y'all know I used to work through agency and I worked as a MED-AIDE a lot. Now, at that place, I'd rather be on the floor as a CNA, believe it or not, because that place was horrible. When I was there, they act like I'm a nurse. Like, I get treated like a nurse, but I'm not getting paid like no nurse. Like, the CNAs ain't doing their job. I get blamed for it. I'm not. I was thinking I'm not no supervisor. I'm not a nurse. I'm a MED-AIDE. And also, I'm not gonna go into too many details, but they did try. Some of the nurses there that's supposed to be over you will try to get you to do things that is not. I'm talking in second person. They will try to get me to do things that were not in my scope of practice as a MED-AIDE. Yes. And over there, when I was working there, the nurses, almost every nurse that worked there showed up late. Like, I'm every single day. I started doing first shift there, so I'll get there at 7 a.m. Supposed to get off at 7 p.m. Sometimes I'll be stuck there till 8 o'clock, 9 o'clock. One time I was stuck there till after 11 o'clock, because the schedule's wrong and all this crazy stuff. And I was thinking, I'd rather be on the floor, because at least if I'm on the floor, I can just leave when it's time for me to go. But, as a MED-AIDE, I can't do that. I don't want to risk losing my certification. Plus, got to count off the narcotics with somebody. And, like, at that place, they would, not all of them, some of them, like, they want me to give them a report. Like, I don't know. I'm going to go to nursing school, honey. I'm a MED-AIDE. My job is to pass out medication to the right patient at the right time. The right route. Y'all know, like, the 5 rights. Like, I don't, like, asking me these questions. Like, I don't know, honey. I don't know. All I know is who had their medicine and how they take it. Do they take it crushed, whole, or whole with applesauce? Stuff like that I know. I don't know nothing about no lab results and this and that. I'm a MED-AIDE. That's why I'm getting paid as a MED-AIDE. So it was just like, it was a lot there. And it was very normal. Very rarely when I worked there I ever left on time, like I said, because whoever's relieving me would always be late. And I didn't, even though I enjoy passing out medicine, that was just too much. Now, at the place I'm at now, I would rather be a MED-AIDE. From what I've seen so far, the nurses, the night shift nurses, they show up on time. They're very nice. I don't really give nobody no report. We just count off the narcotics. And the nurses there, they don't use the agency. They have their own nurses. So the nurses there are already familiar with the patients. I don't even do blood sugars. The other place I was at through agency, honey, they tried to get you to do all kinds of stuff that you ain't really supposed to do as a MED-AIDE. I didn't do it, but they would try to, like, pressure you into doing stuff that is not in your scope of practice. But this place, the MED-AIDEs don't even do blood sugars. The nurses do that. And I believe it's because if a nurse signs off that she checked the blood sugar, they get paid more. I heard somebody say that. So that might be why. I don't care. It's like, I let them do the blood sugars. And it's a lot more organized. Like I said, from what I see, the nurses there show up on time. I'm not really, as a MED-AIDE, I'm not expected to be nobody's supervisor, or if this CNA ain't doing what they're supposed to do. You know what I'm saying? I'm a MED-AIDE. I'm getting paid as a MED-AIDE. So I'm a MED-AIDE. I'm not the charge nurse. I'm not, you know what I'm saying? If you want me to be the charge nurse, pay me $40 an hour, like you paying this nurse, okay? So my answer is, it depends on where I'm working at. Being a MED-AIDE is definitely a lot physically easier than working on the floor as a CNA. You know, I'm not lifting people. I might help, like I say, CNA needs help pulling somebody up in the bed or something like that. I'll help out. But, you know, overall, I'm not physically, you know, doing a lot of physical work. Obviously, I'm standing up when I'm doing my med pass. And I'm not going to lie, I can tell people kind of treat me better when I'm working as a med aide. It shouldn't be like that, but I can tell, like, oh, you on the floor today? Like, but people ask me, what you doing on the floor? You're a med aide. And that's a stupid question, because at this place, there's only 2 hallways. And they already have 2 full-time med aides. One that's been working there for a year, and the other one says she's been working there for like 3 or 4 years. So, obviously, if both of them are working, I'm going to be on the floor. They don't need me as a med aide. I work as a med aide when they are off, or if one of them call out, or if they take a vacation or something like that. So that's a stupid question. But it's true, people do treat you by your job title. Because I could just kind of tell, I just get treated better. I get treated with a little bit more respect when I'm working as a med aide, which it shouldn't be like that. Even by the patients, you know, they can kind of, some of them can say, oh, okay, you doing important work today. You passing out the medicine. Like, as if being a CNA is an important work. So, I do like being a med aide. Yeah, I'd rather be a med aide. If I wasn't going back to school, I would probably want to work at that place as a med aide full time. Like I said, it's a lot better than the other place that I was at through agency, being a med aide. I'm trying to make sure I'm not missing anything. And the nurses are very helpful. Like if I have any questions or something, that's what they're there for. You know, that's why they're getting paid the big money. You know, so that's part of their job. So, you know, if I'm ever unsure of something, you know, I always check with whoever the nurse is over me. I always check with them. What else? Oh, and I'm the type of person, I kind of like working by myself. When I'm working as a CNA, I work by myself. But as a CNA, I don't care how good of a CNA you are. You're going to need somebody's help sometime. Pulling somebody up or dealing with a difficult patient, you're going to need help sometime or another. Working as a med aide, for the most part, I kind of just work by myself. I'm in my own little world. You know what I'm saying? So I'm not dealing with any drama, or I'm not dealing with nothing but this medicine. You know what I'm saying? I'm just in my own little area. And I like working by myself. I'm an introvert. I like staying to myself. As a med aide over there, my lunch break is always the same time. You know what I'm saying? I don't have to, you know, when you're working on the floor, you and your hall partner have to take breaks at different times. So there's always, you know, a CNA on the floor. But as a med aide, I don't really have to do that. I just pretty much, when I'm done with my first med pass around 6 o'clock is when I'll take my break. And really, to be honest with y'all, over there, if you're a med aide, you're really getting like over an hour break, because when you get done with the evening med pass at 6 o'clock, you don't start the night med pass until like 7:30. If the census is high, you might start at 7. But if you work there a lot and you know the patients and stuff, the med aides don't be starting their night med pass till like 7:30. Sometimes they don't start until 8:30. So really, technically speaking, you getting over an hour break. Like, you could just chill and just do what you want to do. Somebody might ask for a PRN once in a while, you go do that. But really, so yeah, I'd rather be a med aide. I ain't gonna lie. But I'm gonna go now, y'all. Don't forget to like, comment, subscribe, and I'll see y'all the next time.